Congratulations on the first steps to a beautiful smile. As discussed in the office, there are a few directions that you should follow to make the first days in braces successful and comfortable. The adhesive used for attaching the braces to your teeth cures rapidly initially, but takes 24 hours to completely cure. You can eat anytime after leaving our office. However, we ask that you be mindful of the suggested list of foods that may be harmful to the braces. Until you become accustomed to eating with your new braces, you may find it beneficial to follow a diet consisting of soft foods. Initially, your braces may feel like they stick out. This is normal. As you become accustomed to your braces and tooth alignment improves, this sensation will disappear. Although the contour of the brackets have been rounded and smoothed, until the cheek tissues have toughened, you may find it helpful to use a small piece of wax around the bracket that is creating the irritation. You will probably notice some discomfort beginning a few hours after your braces were placed. Some teeth, usually the front teeth, may be tender and sensitive to pressure. You may wish to take non-prescription pain remedies commonly used for other discomforts, such as headaches. For maximum effectiveness, it may be best to take such medications before the discomfort begins. There are several routine steps that will minimize discomfort related to irritation from the braces and ensure an optimal response to treatment. Please make these steps a part of each office visit. Using your finger and tongue, check to see that the wire ends do not extend into areas that might poke or abrade the cheek or tongue. Make sure you understand what you are to do until your next appointment. This could include adjusting the expander or following specific hygiene or diet instructions. Make sure you have an adequate supply of wax, special cleaning aids, elastic bands, or other related materials you may need between appointments. Always schedule your next appointment before leaving the office. Waiting 1 to 2 weeks after an appointment before scheduling your next office visit complicates the scheduling process, since appointments are programmed 4 to 8 weeks in advance. Postponing appointments is a common contributor to overtime treatment. If you have any questions, please do not hesitate to call our office. Proper oral hygiene is a critical part of successful orthodontic treatment. As you eat, your teeth and braces collect food. If food is left on the teeth and gum line, bacteria will cause plaque to form. Plaque causes cavities, decalcification, as well as gum disease. Most of the food we eat contains significant amounts of sugar. Since the braces act like a shelf, sugary drinks and foods are especially bad for teeth and gums. It is discouraging to put the time and money into achieving beautiful straight teeth only to remove the braces and find permanent white marks or cavities. Clean teeth do not decay and healthy gums do not swell or bleed. An electric toothbrush is the most effective type of toothbrush available with or without braces. Typically, these brushes vibrate at 30,000 times per minute. We highly recommend this type of toothbrush. If you do not have an electric toothbrush, we suggest using the soft-bristled orthodontic toothbrush and a water pick. A travel toothbrush placed in a purse, glove compartment, or locker to use for brushing after lunch is a good idea. Brush in small circles above, on top of, and below the braces. Brush all molar chewing surfaces. Be sure to brush along the gum line. Brush the inside of your teeth in small circles. Spend approximately 2 minutes each time you brush in order to be effective. This type of thorough brushing would take about the same time it takes to listen to a song on the radio. We recommend using a fluoride rinse each day. The fluoride will harden the enamel and reduce the tendency for decalcification and decay. We also recommend that the toothpaste you use contain fluoride. If the gum tissues become swollen because of improper brushing, we may recommend the use of a prescription chlorhexidine mouth rinse after brushing. If canker sores develop, we recommend 1/2 teaspoon salt to 8 ounces of warm water. Rinse and swish every 4 hours for 5 to 7 consecutive days. We can also prescribe a specially formulated anti-inflammatory medication that sticks quite well to mouth tissue and takes the soreness away very effectively. Flossing is a critical part of proper orthodontic oral hygiene and should be completed once each day. We recommend a floss threader or super floss to guide floss under the arch wire. A floss threader is a nylon loop that conveniently loops traditional floss and guides it through the arch wire. Superfloss is rigid on one end and fuzzy on the other. The rigid end allows for easy threading of the floss under the arch wire. Gently pull and slide the floss up and down between each tooth, under the gum line, and on the perimeter of the bracket. Repeat this procedure for each tooth and bracket to remove plaque. Even though you have taken care of your orthodontic appliances, you may occasionally damage them. Eating, participating in active sports, or even going through your daily routine, you may experience some difficulties. Loose band or bracket, broken arch wires, loose wires, poking wires, lost tie wire or elastic, soreness, headgear not fitting, and accidents involving teeth are all possibilities. If a band or bracket comes loose from a tooth, call our office for an appointment. While a tight band or bracket actually protects a tooth from decay, a loose band or bracket is extremely dangerous and decay can occur under either very rapidly. If the band or bracket is still attached to a wire, leave it in place and apply wax if you are experiencing discomfort. If the band or bracket comes completely out, place it in an envelope and call for an appointment. If a main arch wire breaks, the one that goes all the way around the outside of your braces, call our office for an appointment. Should a wire come loose, try to place the wire back in the tube. Place wax if there is any discomfort and call for an appointment. Sometimes a poking wire can be safely turned down so that it no longer causes you discomfort. If you are unable to take care of a poking wire, apply wax and call our office for an appointment. A lost tie wire or elastic tie is not necessarily an emergency, but please notify an assistant at your next appointment. Soreness during treatment is to be expected. Warm saltwater rinses and Advil or Tylenol are helpful in relieving soreness. Should you experience an accident involving your teeth, contact our office immediately or contact your general dentist. Please remember, if you are involved in contact sports, a mouthguard must be fitted over your braces for added protection.
Remember, orthodontic treatment is a huge investment. There is a lot of time, money, and effort put into your smiles. So let's all work together so you can have a beautiful and healthy smile for a lifetime.